I would like to focus on the fundamentals of it. See, if you technically look into anything called e-learning, that means you're facilitating the learning digitally. What exactly that means is that you're giving the content, you're educating the people through a digital content. Now it comes to the again base level is that who is developing that particular content. Okay, so when it comes to the content development, what e-learning industry looks for is the first the subject matter expertise. Okay, the second thing comes is that the person who can go and draft the content. In our language we call it as a storyboarding, then giving a structure to it, that's called instructional design. Then it goes toward the production part of it, okay, wherein you use the authoring tool to develop it. For my saying that, let it be a digital ecosystem or e-learning, the basic foundation of this particular industry is the core ability to write the quality content. And the things become a little bit more challenging in the e-learning aspect when it comes to the quality content development is because e-learning is not one-on-one. I mean, you're not in a physical environment, and you need to highly motivate the person to take up that particular course and complete it. Okay, so that would be my thing, and the rest, Dr. Satish, you are the best to enlighten on the writing aspects of an e-learning.
Yeah, in terms of writing, there is, you start up with content, it can be towards science or STEM. It also starts with medical education. Today, a lot of medical education and simulations are becoming very important, in making in bringing conceptual clarity and application or problem based learning uh, to the graduates, undergraduates, and the doctors, practicing doctors and nurses also. Apart from that, you have scientific publication writers. You have patent writing, which is in the scientific aspects. Uh, one most upcoming thing is on the patient education. Also, a lot of companies have evolving and budding in the startup areas who are predominantly focusing on patient education. So apart from the startups, if you take any large clinics or large organizations, say for example, let's take Nephroplus or Fresenius Kabi, which focus on kidney care. So chronic kidney care is often associated with a lot of other diseases also, like hypertension and uh, diabetes, etc. So there is a lot of education content that needs to just not make the people understand how you get your treatments and how you try to keep up with the management of your treatments. That has been one aspect, but the shift that is happening is it is how can you prevent this. So education is the best way to prevent anything and also manage something. So today there is a lot of emphasis towards education, health, wellness, diet coaching, mental wellness coaching, and all of that. The focus is entirely on huge amount of content that can be converted into an engaging form of learning for the end users or patients. So that I think is the key, and that's where the actual happening is in the medical education segment. Also, medical technology based education is becoming very famous because a lot of devices which used to be handled only by the doctors are being used mostly by the non-clinical staff these days. So a lot of procedural uh, documentation also is done in terms of infographics or different even audio content, so that a person can play this and follow the procedures accordingly. So there are a lot of things going on, and uh, I think for non-clinical people the scope is pretty much good.